Dear students, we talk about the irritable bowel syndrome. The learning objectives, first of all, epidemiology and etiology. Second, clinical presentations. Third, approach to diagnosis and differential diagnosis. And lastly, the management. Irritable bowel syndrome, in other words, it means absence of structural pathology. It affects about 20% of the population. Young women is about 2 to 3 times more commonly than men will be affected by this disease. There is an overlap with other conditions such as non-ulcer dyspepsia, chronic fatigue syndrome, dysmenorrhea, and urinary frequency. The etiology, there is no specific fixed factor or etiology. However, we have many theories and possible explanation of this syndrome. For example, first of all, the psychosocial factors. However, most of those patients do not have psychological problems. Second, the altered gastrointestinal motility, which may affected by genetics, by foods, infection, and even inflammation. Another theory or possibility of the cause is abnormal visceral perception or autonomic dysregulation. Another important factor may play a role is the luminal factors, such as diet, for example, lactose and wheat, microbiome, bile acids, and abnormal permeability of the lumen. Clinically, colicky or cramping, lower abdominal pain. Patient may have bloating. Other presentation is variable bowel habit. Mucus is common, but rectal bleeding does not occur. No evidence of weight loss in this syndrome, and no constitutional symptoms. Usually, physical examination reveals no abnormality. If any patient presented, for example, with rectal bleeding, any evidence of weight loss, abnormal constitutional symptom, abnormal finding during physical examination, those group or signs regarded as an alarming physical signs warrant a thorough investigation. Usually, the diagnosis is a clinical one, and if there is a high possibility of the patient to have an irritable bowel syndrome, which is usually those young, and it's more common as we mentioned in female, we have to do a simple test, for example, full blood count and ESR, and we have to do a sigmoidoscopy, which is a routine even in a straightforward cases. We have to put a differential diagnosis in those patients who have a predominant diarrhea irritable bowel syndrome. For example, microscopic colitis and other inflammatory bowel diseases, lactose intolerance, bile acid malabsorption, celiac disease, thyrotoxicosis, parasitic infection and bacterial overgrowth, psychological disease. The patient may have a psychological disease. Another is miscellaneous conditions such as endometriosis and endocrine tumors. The management of patients with irritable bowel syndrome, first of all, is reassurance. Elimination of diets are generally unhelpful, but up to 20% may benefit from a wheat free diet, lactose exclusion, and excess intake of caffeine. Amitriptyline and other antidepressants may be helpful. In addition, 5-hydroxytryptamine agonist may be helpful. Thank you very much.